Okay. All right, good morning, everybody.
Good morning.
I want to thank all of you for being here. Particularly, I want to thank Commissioner Kevin Morrison, who serves the 15th District. This is his district, as well as Israel Rocha, CEO of Cook County Health, Iliana Mora, who's Chief Administrative Officer for Ambulatory Services for the healthcare system. I'm proud to stand in front of you today to acknowledge the continued investments Cook County and Cook County Health are making to expand access to behavioral health services in our communities. Mental health is inextricably linked to a person's overall health and well-being. We know that depression increases the risk for many types of physical health problems, including long-lasting conditions such as diabetes, heart disease, and stroke. 50% of Americans, that's half of Americans, recently reported symptoms of an anxiety or depressive disorder. And during the pandemic, the need for mental health services skyrocketed to an unprecedented level. It should be no surprise that individuals who are impacted most are those who are often unsupported or marginalized, including Black and Latino people, people with financial or housing insecurity, mothers and pregnant women, and people with disabilities. It's essential that we lift these individuals up and provide care to all in our community who need mental health support. Behavioral health services have long suffered from underinvestment and stigma. We're here today to say that one's mental health is just as important as their physical health. Cook County Health plays an important role in our county, ensuring access to quality care for our residents who are most in need. It's a privilege to be able to direct $160 million in American Rescue Plan funding to support the expansion of programs at Cook County Health, with a significant portion of that funding, $111 million, being dedicated to behavioral health initiatives. I'm going to say that again. $160 million of our ARPA money is going to Cook County Health, and the overwhelming majority of that, $111 million, is being dedicated to behavioral health services. I'm glad to see that essential roles are being filled to address our community's needs and improve the health of Cook County residents, and look forward to the advancement that's to come. And now I'd like to bring to the podium Commissioner Kevin Morrison. Let me get my mask. Thank you.
No problem. Thank you so much, Madam President, and good morning, everyone.
Good morning.
I'm Cook County Commissioner Kevin Morrison of the 15th District, and I represent the Northwest Suburbs. I want to give a special thanks to President Preckwinkle, CEO Israel Rocha, Chief Administrative Officer Iliana Mora, and others for having me here today. I'm proud to be standing here as we announce a new behavioral health social worker to help serve the residents of the Northwest Suburbs and to bolster these types of services at Cook County's satellite clinics. Ever since I began running for this office, I have fought for increased mental and behavioral health resources here in Cook County. The thing I've heard across my district and continue to hear today as I knock on doors is the lack of access to mental and behavioral health resources. I've even heard from residents that several of their loved ones had to be sent out of state to access these types of services. I knew that we could not allow that to continue any longer. With amazing partners and leaders like President Preckwinkle, I'm pleased to see these issues continue to be addressed as we continue towards a future that destigmatizes mental health care. As we continue to bolster these types of services, I'm also excited by the upcoming Department of Mental and Behavioral Health, and I hope to see this become a landmark for Cook County and a model for others across the nation. It is my belief that access to mental health resources should be both easily accessible and affordable, and I think this is a major step in reaching that goal. I look forward to seeing the future progress Cook County makes on this issue, and I'm excited to be part of these expanded efforts. To me, this is actually personal. I know that I would not be standing here today had it not been for my access to a therapist in my youth and early adulthood. Suffering from anxiety, depression, and even a bout with PTSD. Had I not had access to mental health resources, I would not be able to lead an effort helping see an expansion in these resources across Cook County. And so I'm thankful for the access that I had received, and I look forward to pushing and continuing the fight to make sure that everyone is as fortunate. And without further ado, I want to thank you again for having me here today, and I would like to introduce Israel Rocha.
Good morning, everyone. As we
Good
said,
morning.
good morning. As we said, my name is Israel Rocha, and I am the CEO of Cook County Health. I would like to start by thanking President Preckwinkle, Commissioner Morrison, the entire Cook County Board of Commissioners, as well as our System Board of Directors for their dedication to ensuring access to behavioral health. Behavioral health is one of the greatest challenges we have in our country, and the reason for it is that often we suffer in silence. Too often, issues of behavioral health, mental health, our ability to be able to be comfortable with who we are, how we are, and what we're confronting is often blinded in the behavioral health space. More importantly, every day, we need more people to stand up, to be able to say that they need treatment. And most importantly, what we're doing here today, to have places for people to go. We're very, very pleased that Arlington Heights and very soon the rest of our system will be leading the way in integrating mental health services into our clinical services at all places. Our message today is one of simplicity. If you have any questions, if you have concerns, if you're suffering in silence, please just come to our clinic. Very soon we want each one of our clinics to be a point of access. So when people are suffering, they know where to go. We're expanding our clinical services throughout our network and working to do that aggressively, to ensure that everyone knows if they have any concerns, if someone they love, someone that they care about is needing assistance, we're going to make it seamless and easy for you to be able to access those services. We're working hard to meet those needs, partnering with organizations, community-based organizations, other healthcare providers around our community and throughout Cook County. The way that we are going to solve the need for mental health access is to work together as a team. That is why last week we were so pleased that the Cook County Department of Public Health announced that they will be awarding over $14 million in grant funds across 4 years to expand mental health services and substance use prevention to support Cook County residents, programs, and clinical offerings. The grants will range from $250,000 to $1 million each and are part of the Building Healthy Communities, Building Healthy initiative funded under ARPA that President Preckwinkle spoke about. Our goal is to make sure that this grant process is equitable, inclusive as possible, and encourages everyone and all organizations to participate. We can and we will succeed together in helping to address mental health challenges in our community. The Cook County Department of Public Health will be holding workshops to help applicants who may be less familiar with the grant application process and requirements needed to have a successful completion of their application. Applications will be accepted through Wednesday, December 7th. For full details, please apply online. Visit the bhcopencall.com. That's again, bhcopencall.com. So it stands for Behavioral Health Coalition, opencall.com. And we can have this information on our website, and we'll also be at the Cook County Department of Public Health website. Now, I'm very pleased to welcome our Chief Administrative Officer for Ambulatory Services, who is a key component in helping to bring mental health access to our community, Iliana Mora.
Good morning.
Good morning.
Thank you, Israel. Thank you, Madam President Preckwinkle, and thank you, Commissioner Morrison, for your advocacy and leadership in bringing these needed behavioral health services out into our communities that are so needed. Here at Cook County Health, we believe that physical and mental health are intertwined into the day-to-day lives of all community members in Cook County. The body and mind are both connected and leads to an individual's personal well-being. Personal mental health, good mental health, has an impact on the daily lives of individuals, families, schools, in the larger community, and the impact is important to have the resources needed to ensure that people have access to behavioral health. Our community health centers, like here in Arlington Heights, are setting up an integrated behavioral health model, whereby our behavioral health therapists are embedded in the clinical setting and ensuring that once you come in for your medical appointment and a provider, a doctor, sees that you have, any patient has potentially an additional behavioral health need, our behavioral health therapists are integrated within the clinical setting to ensure you have access to behavioral health therapy or any other mental health services here when you come to visit. We are committed to ensuring that everybody has access to behavioral health. Today we have with us Damaris Moreno, who is our behavioral health therapist here at Arlington Heights. She is part of a program funded through the ARPA program, thanks to the Board of Commissioners, Commissioner Morrison, as well as, of course, Madam President Preckwinkle, It is part of the funding that we have received of $5.2 million of ARPA funding that will help us add behavioral health services in our community health centers. You will hear shortly from our behavioral health therapist to tell us a little bit about her work here. While she will be providing behavioral health therapy here at our location, we will also be expanding the services that we provide to include substance abuse care as well as support for eating disorders of children or adolescent counseling services that are very much needed. Additionally, we will be providing and expanding the time that we are available to the community for behavioral health therapy as well. And now I will say a few words in Spanish. Cook County Health cree que la salud mental de una persona es tan importante como la salud física. En nuestro sistema de salud integramos a las terapistas para que ayuden no solamente en las terapias, pero también en la área médica. Cuando usted viene a ver al médico y de pronto hay necesidades de salud mental o no necesariamente se están sintiendo bien emocionalmente, el médico va a estar aquí para ayudarle, pero también tenemos terapistas que van a estar disponibles a su médico y a usted para ayudarle a su familia y a usted con cualquier asunto que tenga de salud mental o de salud emocional también. Estamos aquí para servirlo a usted y a su familia en cualquier necesidad que tenga de salud mental. También estamos trabajando en conexión con la comunidad directamente y estamos ofreciendo 14 millones en fondos para invertir en nuestra comunidad, para ampliar la prevención, el tratamiento y el apoyo a la salud mental en los usos de sustancias en los suburbios del condado de Cook. Vamos a estar aquí para ayudar a la comunidad, no solamente en nuestros centros médicos, pero en la grande comunidad afuera de nuestras clínicas también. La fecha para inscribirse para los fondos y para aplicar para esos fondos es el 7 de diciembre. Por favor, mire a nuestra página web para aprender más detalles sobre los fondos disponibles para la comunidad para apoyar la salud mental. Muchísimas gracias. Y ahora va a seguir nuestra nueva trabajadora social y terapista que les va a hablar un poquito sobre los servicios que ella está proveyendo. La señora Demaris Moreno. Gracias. Good morning.
Good morning.
Good morning. My name is Damaris Moreno. I am a bilingual licensed clinical social worker. I am very excited, very happy to be here. I will be taking on the role as a mental health provider here at the Cook County Health in Arlington Heights location. I believe everyone deserves and needs mental health services, and I am very excited to be able to provide that for our community. Thank you.